Is it time to pick your insurance plan? Well, I want to talk about the 5 key indicators to a good plan from an insurance provider. So first thing to look at is the deductible. So this is the amount of money you're going to pay out of pocket for all of your healthcare needs until you reach it. So let's say your deductible is $3,000. You are going to pay for every single thing that you do for your healthcare, with the exception of preventative care, until you reach that. So you have to pay your premium. Let's say it's $100 a month, very low, very reasonable. So you're gonna pay $1,200 for the year for that. But then if you have a $3,000 deductible, now we're looking at $4,200 for the year. And then once you meet your deductible, oftentimes there will be a split. Oftentimes it's an 80-20 split. So now your insurance will pay 80% and you pay 20% until you reach your out-of-pocket max. So if your out-of-pocket max is $6,000, now you're gonna continue to pay up to $6,000. Once you get to that $6,000, then your insurance will cover 100%. So first thing to look at is your deductible. Second thing to look at is that out-of-pocket max. What does that look like? If that out-of-pocket max is going to ruin your life, then it's too high. So if the out-of-pocket max is $10,000 and that's going to ruin everything, you don't have that in your finances, then you really need to consider a different plan. Another thing to look at is copays. So if it's not a high deductible plan, it might be a copay plan. This is where you pay per service. So if you go to see a primary care provider or you go to a specialist, what do you have to pay out of pocket? These are not deductible plans, they are copay plans. And so you pay that flat fee every time you go. So if you're only going to the doctor twice a year, then which is better, the high deductible or the copay? I'm gonna tell you probably the high deductible, but I don't know your health history. So when it comes to high deductibles versus copays, the people that do well on high deductibles are those that don't necessarily use their insurance a lot. They don't have to go to the doctor, they don't have any chronic diseases, no chronic medications, especially expensive branded medications, where those who may have those chronic problems that need to see a lot of specialists, do a lot of images, have a lot of surgeries, that sort of thing, those are the ones that really do better with those copay plans. Another thing to consider is ER visits. How much is covered? So I'm gonna tell you, if you're paying more than 10% or $100 on your plan, it's probably not a great plan. So ER visits are really, really expensive. Obviously you want to avoid them if you can, but they also exist. So that's the fourth thing to look at, is the ER cost. And the fifth thing to look at is medication costs. So a lot of medications are generic and you can get them pretty cheap on GoodRx, but there are some really expensive medications out there as well. So you need to look, if you are on a medication, you need to look at the formulary of that insurance plan to see if your medication is on there. Because if not, we're gonna have to change that. And I'm gonna tell you, insurance companies change their drug formularies every year. So just because it's on there this year doesn't mean it's on there next year. So pay attention to this. So 5 things you need to pay attention to: deductible, max out of pocket, copay, ER costs, and drug costs. So I hope this is helpful.